Hello, this is Rachel from thehealthywomb.com. This is WombTube, and today I'm going to talk to you about polycystic ovarian syndrome and therapies, what therapies can help. So this is quite an exciting one for me, and it splits into two different answers. There are therapies that can directly help the PCOS symptoms and therapies that indirectly help. So let's look at the therapies that can directly help the symptoms first. So I'm a fertility massage practitioner, and it's one of the therapies that I use on myself to relieve my symptoms and also on many of my clients. So of course I'm going to say get yourself an abdominal massage. There are different abdominal massages out there, not just fertility massage. But anything that helps improve the blood flow to your pelvic area is really, really helpful. Reflexology can be helpful for this too. And also things such as yoga. I particularly like yoga because that's more restorative. And swimming, because swimming actually uses your whole body, and you do move your torso a lot more than you realise. But try and stick to more gentle styles of yoga and swimming, not sort of thrashing around the pool or ashtanga or anything like that. The reason why will become apparent in a little while. Other therapies that are great is nutritional therapy. So PCOS is a condition that's caused by insulin dysregulation as well as a number of hormonal imbalances. So getting your nutritional input is really, really essential. And the two of those are probably the most direct ways of dealing with PCOS by using therapies. Some self-care you can use at home are castor oil packs. I do actually have instructions how to do these on my special web training mini-series on my website, so you can go along there and download it, but you can find other sort of recipes and methods of doing castor oil packs on the internet. Now, finally, the indirect therapies. Now, one of the things with hormones is that all of them are pretty much set off if you have any stress, because stress produces cortisol. And the problem with that for PCOS sufferers is that the liver then causes glucose to be released into the bloodstream, and then of course you get your insulin spike. Not only that, but your reproductive system is the only sort of optional system in the body, so it's the only one you don't need in order to sustain life. So if you're under any kind of stress, and it's different degrees of stress to different people, your body rediverts its resources elsewhere, so it will reduce the blood supply, it can halt ovulation, it can stop a pregnancy. So stress is a pretty major thing for your reproductive system. So any therapy that reduces your stress could help, whether this is a talking therapy such as CBT, which is cognitive behavioural therapy, or something like EFT, which is also known as tapping. But even just going for a massage or going for a walk, art therapy, taking time to read, taking time for yourself, or even just making time for yourself in the evening to have a bath, or arranging with someone else to look after the family or babysit for you, or spending some really good quality time with your partner can help with your stress. So that's my answer to how does stress help with PCOS. I hope you found it useful. If you want to contact me, my website is www.thehealthywomb.com.